Hello, I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida, and the topic today is how to control an anxiety disorder. Some of the materials you might need would be a quiet place, a piece of paper and a pencil, or a journal in order to reflect and to be able to record your thoughts. When we talk about anxiety, anxiety is one of the 4 blocks to happiness. The other 3 are depression, guilt, and anger. Now, it's important to recognize that anxiety is nothing more than a reflection of thought. So if you want to change or control the anxiety, and as far as controlling the anxiety, really talking about minimizing it or hopefully eliminating the symptoms. But if you want to minimize or eliminate the symptoms of anxiety, it's important for you to change your thinking. Now, there are other types of anxiety, which we call endogenous or biological anxiety, but that's really driven more from brain chemistry or some hormonal dysfunction. But most of the anxiety we see is really driven by thought. The model that we use for eliminating or controlling anxiety is the ABC model. And this model starts with the A activating event, and that's the stressors, what you're getting anxious about. So we identify the A activating event. The C of the model stands for consequence, how you feel and what you do. In this case, the anxiety and all the symptoms that go along with anxiety, which can be avoidance and lack of concentration, a lot of physiology as far as chest pains, heart palpitations, muscle tension. So that's the C. The B of the model stands for beliefs, or your thoughts about that activating event. And the beliefs we're talking about here are really the evaluative beliefs. And so we have the ABC model: A, activating event, what you're anxious about; B, what you tell yourself about that activating event; and C, the emotional consequence, which is here the anxiety. So what we're trying to do is challenge those B's. So we record an emotional episode, ABC, something happens, I don't do well, I get anxious, I don't perform very well. And we begin to search for, what am I anxious about? A, what am I feeling? C, that's the anxiety. And B, what am I telling myself? The thinking that we're looking for is the irrational thinking, because we want to maximize irrational thinking, maximize rational thinking, minimize irrational thinking. Irrational thinking comes in the form of kind of a criteria, not a form, but the criteria for irrational thinking we call ELF, E-L-F. E stands for empirical data, fact or fiction. L, logical, does it make sense? F, functional, does it keep you out of conflict with others? Does it help you preserve your life and limb? Does it help you achieve short-term and long-term goals? If you flunk or it doesn't meet criteria for those components, then we consider it irrational, and we need to replace the irrational with a more rational idea. Then we work hard, work and practice at changing the thoughts. It's important to remember that to take 100% responsibility for how we think, feel, and behave, that feelings are driven by thought, and the only way you're going to achieve real elegant change over time, in this case controlling or minimizing anxiety symptoms or the disorder, is to work and practice, work and practice. I'm Dr. David Thomas, talking to you today about how to control anxiety.